think we need to schedule some additional tests. Those aren't the words that most people want to hear from their doctor. A few months ago, you fell and hurt your knee, and this is your third trip to the doctor's office, and it just doesn't seem to be getting any better. You did everything that WebMD said: heat, ice, rest, and then a trip to the doctor's office. Still no relief. Now your doctor wants to schedule additional tests. In fact, an MRI. You've always heard that those scans can be very expensive, and while you're eager to find out what's causing the pain, you're concerned about the cost. How much will it be? Can you afford it? When you don't even really understand all of your health care benefits. Health care benefits should be easy to understand, because when consumers are armed with the appropriate information, they can make better medical decisions for their family and budget for unforeseen medical emergencies. Health care is a hot topic these days, as many Americans are faced with choosing health care in the midst of the government's continued attempts to repeal the Affordable Care Act and the rising cost of health care. Consumers like yourself want to know exactly where you fit in. From the White House to your house, how does it impact your bottom line? One of the most important things that consumers should know is that health care, in its simplest form, is simply a contract between you, the consumer, and the health care insurance company. There are multiple insurance companies to choose from and a variety of plans. Based on factors such as economic, health status, and cost, consumers now have the power to consider the best plans for their family. Whether you're covered through an employer-sponsored plan, individual coverage, or via the marketplace exchange, you can choose the type of coverage that best fit your needs. Understanding that coverage is a different matter. A study detailed in the Journal of Medical Care in 2008 by Mayo Clinic researchers led by Dr. James Naessens concludes various factors affect decision-making of employees regarding the choice of plan with different levels of cost. The health status of employees and their dependents played a very significant role in plan choice. The more health status becomes a factor, the probability of choosing a health care plan with higher premiums. Most consumers want to mitigate the need of choosing insurance based solely on health factors, as cost is a concern as well. For some, choosing a health care plan is not the most complicated part of the equation. Once you've chosen coverage, what does it all mean? How does it work? The language can be confusing and can hinder the ability to choose a health plan that covers the needs of your family. According to a newspaper article in the State News Service, new rules went into effect effective September 2012, requiring insurers to provide concise, plain language descriptions. Insurers must now make a summary of benefits and coverage available for every policy, describing the basic features of that policy. The paper goes on to say this little-known fact of the Affordable Care Act takes the jargon, lingo, and buzzwords and other confusing language out of health plans. As a healthcare worker, I can attest to the fact that patients are often confused about what their health plan covers and how the benefits apply to them. When consumers have a clear understanding of their insurance policy, they tend to make the appropriate decisions for their health and their wallet. Equally important to understand is the healthcare terminology. Knowing how your healthcare plan works and how those terms apply to you. In an article published on the website moneyunder30.com in May of 2017, David Weliver explains why it's important to know the difference between deductibles, co-payments, and co-insurance. He says, armed with this information, you can fairly compare plans through your state health care marketplace and those offered by your employer. So what do the terms mean? How will they impact your wallet? Let's break down the terminology in order to gain a better understanding of the financial impact. Deductible. Deductible is the amount you must pay for covered health services before your health insurance kicks in. For example, Luke's deductible is $2,000. His insurance won't pay anything until he has paid $2,000. If Luke requires hospitalization and the costs are $3,000, he would pay $2,000 and then the insurance company would pay the remaining $1,000 based on his plan specifics. Co-payment or co-pay. A co-payment is a set dollar amount you pay for a covered product or service. Sarah has a $20 copay for her primary care physician and a $40 copay for urgent care. Anytime Sarah visits her primary care physician, she pays the set rate of $20. Coinsurance. Coinsurance is the percentage of the bill you pay for a covered product or service. Let's say Tony visits his in-network doctor when he's ill. He's met his deductible and he has a 20% coinsurance. The plan's contracted rate is $150. Tony would pay $30 and his insurance company would pay the remaining balance. That's his coinsurance. Out-of-pocket maximum. The out-of-pocket max limits the total amount you pay for each calendar year. So Sarah has, Lisa's out-of-pocket max is $5,000. That means in 2018, Sarah will not pay anything over the $5,000. Once that's met, her insurance company pays her bills at 100%. It's very important to know these terms as you shop for coverage. So you finally agreed with your doctor and decided to have the MRI scan. You're still concerned about the price, but you now have a better understanding of how your plan works and the cloud of confusion has been lifted. With the information that you've learned, you know just how much you will owe once the services have been completed. The old proverb, forewarned is forearmed, seems fitting in this scenario. Being prepared with the knowledge of your health care costs affords you the opportunity to make the best decision regarding coverage and care for your family. Thank you.